This meeting is being recorded.
All right. Well, welcome everyone. Happy New Year. Here we are, 2025, turning the page on our Jurisdiction Advisory Committee meetings for HB 4086. So I want to welcome you all back after the holidays. Just wanted to welcome folks that are here for the first time or standing in for a regular member. I know we have a couple folks that are out, and so I thought we could do a few little introductions first. If you all wouldn't mind just putting your name and role in the chat as you typically do, and then I want to give our couple of our guests as well as our stand-in members a chance to introduce themselves with their voices if we can. And just for all of our new folks, I'm Leslie Ann Hay. I'm one of the co-facilitators here along with Sylvia DePorto. And I happen to be in the same location right now with Sylvia, so we're just a room away. So why don't we have Lindsay Moore introduce herself real quickly. Lindsay?
Hi, I'm Lindsay Moore. I'm from DOJ. I'm with the Child Advocacy and Protection Division and the Statewide Advice and Certification Unit. I'm here instead of Kristen Ward today.
Okay, thank you so much for covering for Kristen. We appreciate that. Roy, do you want to introduce yourself?
Good afternoon. Thank you for having me. My name is Roy Smith. I'm a data analyst with Oregon Department of Human Services, Child Welfare. I'm in the I'm in the Strategy and Innovation Office.
Okay, excellent. Thanks so much for being here, Roy. We'll hear from Roy a little bit later. And then how about Leslie Lanier?
Hello, my name is Leslie Lanier. I'm with Child Welfare. I'm a Child Safety Lead Program Coordinator. Happy to be here to help answer questions today.
Okay, excellent. Welcome to you as well, Leslie. And thanks to everybody else for adding their information in the chat. I did want to also just hope you all got a good restful time over the break and had time to enjoy time away from work and with family and friends, and a little bit rejuvenated as we move into our new year here. I did want to go ahead and with that as a check-in, go ahead and pop into the chat as well. Just what's your fondest memory that you have of your holiday break? I hope you all got one, at least a couple of days. And if there's something that you would like to share that's really inspired you and kind of giving you a shot in the arm for turning the page on the new year, whether that's visiting grandchildren or, getting the thing you wished for under the tree, whatever you'd like to add that kind of can help. Skiing with my teenager. Wow, that is a rare moment and fantastic. Oh, Chris moved into a new home. Amazing. All right. Lisa Joy, rest and relaxation. Iris took lots of naps with her dogs. I love it. That's great. Family time for Tori. Ooh, and a trip to Bend for skiing for Brian. I love it. The snow was big this year, wasn't it? Yeah. Oh my gosh, Sarah Stewart went to Disneyland with your under 3-year-old. I love it. Oh my gosh, Annalise, I'm with you. I had something similar hit me just a few days ago. I'm so sorry. I hope you're feeling better.
Yeah, thank you. Almost 4 weeks later.
Oh, yes, but now you're going to be a first-time grandparent. Congratulations.
Yeah, that's really exciting.
Excellent. And Nicole tended to your plants, so they're looking fabulous now and baked up a storm. And Roy consumed his wife's rum cakes. I love it. That's fantastic. Excellent. Well, my biggest treat is that I'm here in Hawaii with Sylvia. So even though I had a little bout of the flu as well, at least I get to look out at the beautiful landscape here. So I am going to thanks so much, everybody, for sharing those wonderful moments and memories. And let's take all that joy and energy into our work today. Sylvia, would you like to kind of review our agenda for this afternoon?
Sure. Welcome, everybody, and Happy New Year. We're going to focus on the scope of jurisdiction and have a conversation about that, and then make some decisions really about some work groups that we're going to form today. So one of them will be around jurisdiction. And then we're also going to examine the threat of harm and neglect definitions today, and probably look at a work group for that as well. And then we spent a little bit of time just preparing for the work that we have ahead of us, since we're moving quickly through this process. So we really need to focus and talk about our next steps. So that's our agenda for today. Just a reminder of our community agreements. Bring your curiosity, reflections, vulnerability, skills, courage, and authenticity. Keep ourselves and each other focused on what is our mission. Open ourselves to each other's perspectives and experiences and suggestions. Stay oriented towards solutions that move us towards our goal, and seek out, engage, and respect all the voices that are impacted by our mission here. All right.
All right, excellent. And I did want to mention too, apologies for a little bit of a delay over the holidays, but the notes from the last meeting, as well as the recording of that meeting, are all up now on our website, and you can all access that public site to be able to catch up if any of you did miss our last December 18th meeting. So, but we're going to try to bring everybody up to speed here. As Sylvia said, we wanted to really lift up a couple of these key issues that are really feel like cornerstones of our work together, and really drive the rest of the recommendations that we may be making. And one of those is the scope of jurisdiction for the state of Oregon's child welfare enterprise, right? We want to take a look at the current scope of jurisdiction that exists in Oregon. We want to do a little bit of comparing that to what we've learned through a series of interviews with comparison states that Sylvia and I have been talking to over the last several weeks. And then we want to just pick up an idea that really emerged from some of our previous discussions, is really starting to frame a conversation and an exploration of envisioning what a different kind of scope of jurisdiction might look like for Oregon, based on what we have learned from other states, based on what we know to become some of the unintended consequences of the current scope of jurisdiction that exists in Oregon. And so we're not trying to make a decision about that vision today. We want to lay out sort of a straw person for you all to begin to give you a framework to think about that together, and pick up on another idea that came up in our last couple of meetings, or several meetings, which is to formulate some subcommittees within this committee to really drill in on defining the elements of what that new vision might look like, and bringing that back to the committee so that we can make a decision around that, and have that inform our recommendations. So with that, we wanted to put this graphic out for all of you that kind of speaks to what is the current scope of jurisdiction for the state of Oregon right now. As you all remember, one of the issues was with this particular topic is that, Oregon does not identify who is the subject of the child abuse laws in the state, right? Which has really resulted in interpretations landing on the fact that really everyone is subject to child abuse statutes in Oregon. And so when you look at this span, we tried to do this in kind of a concentric circle kind of depiction here. If you start at the bottom of this slide, we have the traditional, familial and in-home caregiving role, parents, guardians, in-home caregivers, minors in the home, basically everything that has to do with the home environment of a child, right, is really the starting point. And then beyond that, of course, Oregon has made a concerted effort, as have many other states as well, to make sure that children are safe when they're in out-of-home care settings as well. That includes, resource parents, proctor home providers, congregate care providers, other paid out-of-home care providers, right? To really expand to, when we place a child in care, we want to make sure they're at least as safe. And in Oregon, we want to make sure they're even safer than they would have been otherwise. And so that's kind of the next outer consent, the circle outward of expanding the scope of what ODHS is responsible for. And then there's it goes farther than that, right? In terms of, we're kind of classifying this as, temporary caregiving roles, right? These are not living situations, but these are other environments where individuals have a caregiving role for over children, right? Whether that's teachers, school personnel, daycare providers, relatives who are outside the home in a caregiving, with caregiving responsibility for that child. And then in Oregon, and that's also handled, right, by OTIS for the most part, right? So it's still a responsibility of child welfare in Oregon. And then finally, there's this, sort of additional outer circle, which is no caregiving role really at all, but someone that encounters a child and may harm them in some fashion, at least for investigation purposes and to determine the safety of that child and respond to that safety need. That also is the responsibility of ODHS in Oregon. Yes. So thank you, Adam, for that clarification. And so I think that's a point of clarification that Adam's making is that OTIS is part of the larger agency structure, right? And not part of child welfare per se, right? Although there's a close collaboration that may happen in certain instances around that, right?
Yeah, collaboration, but no shared reporting structure, organizational reporting structure until you hit the head of ODHS, until you get to Fair Force. Because OTIS reports to the Chief Operating Officer, Seth Lyon, whereas Child Welfare is going to report up to, I think, Liesel is the Deputy Director, and then to Fair Force.
Okay.
So there's no overlap there's no overlap in authority or directed teamwork until you hit the very top of the entire organization.
Yeah. Interesting. Okay. And we haven't really, I think we should put a pin in that, right? And exploring what impact that may have as well. And so, you know, this whole span, right, that that Oregon, that this picture for Oregon, it is a really interesting one because it feels pretty. It's broader than any other environment that we were able to research or encounter, right? And it's really unique, right? That it doesn't really define a narrower scope of potential perpetrators for child abuse, right? That most states really define the scope of the perpetrator within the definition of each child abuse type, and limit most child abuse types to persons you know, responsible for the welfare care child, right? Meaning parents, guardians, caregivers, or caretakers, or even those that may assume some of these caregiving roles. Typically not out to this upper top level, right? As still within the auspices of that either child welfare agency or a special unit within the umbrella agency that holds child welfare. Sarah, you've got your hand up too.
Yeah, I just also wanted to clarify that I see you have minor listed under familial and in-home, which is true because sometimes the minor that's having the behavior that might be considered abuse, you know, is a family member living in the home, a sibling, whatever. But also ODHS is responsible for investigating minors who might be alleged perpetrators who are community members. So
we're up here.
Yes.
Yes.
So
I almost pulled out minor here as well. So you would add that here overtly, right?
I would just, yeah, I mean, I would just want to really make sure that the committee is keeping that in mind, that as you start thinking about and discussing the question of investigating minors, there are some nuances to that question, some of which are sometimes those minors are siblings. Or cousins, live in the same home, etc. And sometimes they are minors who do not and are just other community members.
Exactly. Okay, good. And I think there's Annalise, you had your hand up as well.
Yeah, I would also add that the out-of-home caregiving role, is this just CPS and we're going to do a separate OTIS screen?
No, this is everything.
Okay, so out-of-home caregiving role, childcare, right? I don't know where childcare fits in. Which one of those is childcare?
Daycare. I put it in temporary caregiving role. Yes.
Okay. So with daycare provider, I think you also need to add minors because this is one of those weird things where if the daycare provider has an older child, minor child, who is alleged to have perpetrated abuse against a child in care, then that minor child might be investigated.
Got it. Yes. Okay. Another good place to specify minor. And again, you know, this is interesting. These are unique clarifications for Oregon because, again, most states in their definitions define who is considered a perpetrator for these various abuse types. And that's not done in Oregon. So everyone can be a potential perpetrator, from minors to, you know, strangers to everybody in between. So you all know those details, and because of, you know, implementing this, but it makes it very confusing for this picture to ever be accurately compared to like federal measures and other states and have any kind of benchmark for yourselves on how you're actually doing with respect to abuse, because it's kind of apples and oranges in many ways, right? You can't get a clear sense around who are we talking about in your reporting structure, because it's so broadly defined. Tori.
Yeah, I think there's one more group that we haven't really touched on,
Okay.
which is this group under the dependency codes of children who are beyond parental control, which is also there's not allegations against the parent, but it's still an area where the court can take jurisdiction. You know, kids that may need the BRS level of care services, and the parents may be in agreement with that or may not, but may not be able to access. They need the state's assistance in accessing the services that they need for their child.
And are you thinking, Tori, of situations where those children beyond parental control are victims of child abuse or are perpetrators of child abuse?
They could
or
be
both?
neither. They could be neither, actually.
Oh, neither.
Yeah, the DHS does could have jurisdiction over those youth as well.
Okay, so but from an investigative standpoint is kind of where our scope lives, right? It's investigating harm is our task here, as opposed to the broader goal of delivering service to kids in need.
Those kids that Tori's referring to are served through a process called Family Support Service referrals, not Child Protective Service investigations. So that's outside the scope of this committee.
Yeah. Okay.
Because I was kind of thinking of situations where the court would take jurisdiction, which
Right.
Family Support Services is usually voluntary.
Well, under the circumstances where the court takes jurisdiction and places the child with the agency, that qualifies for Family Support Service referrals. And that's how we serve those families, unless through the course of the Family Support Service case, we learn of an allegation, and only then is CPS assigned to do an investigation. I think the word jurisdiction is getting kind of in the way here. We're talking about the jurisdiction of child welfare to conduct investigations. And I think that's getting mixed up with the jurisdiction of the court to place children in our care for other reasons that have nothing to do with child abuse.
Okay. That makes sense to me. Thanks for that clarification.
Sure.
And I just want to make sure that we don't lose, because that's an important group of kids also.
Yeah, important in terms of them having a need that may go unmet, but for our purposes, when we're talking about scope of jurisdiction, we're talking about the scope of jurisdiction for abuse investigations, correct? Yeah.
Yes, I think I got it now.
Yeah, me too. I mean, believe me, we get tested on this every day. So I'm really glad you asked the question. That's a great test of this. And I note here too that, yeah, we can definitely change any of the wording in here, Annalise. If childcare is a better term than daycare, that we can definitely edit that as well. I was just trying to get my language straight so I wasn't getting confused with child caring agencies, which is also a term used in Oregon that, you know, but when you guys say childcare, you mean daycare, right? Yeah. Okay, good. All right. So does that feel like kind of a depiction of how Oregon sits right now in terms of the span of ODHS, you know, involvement, if you will, with this very wide scope of jurisdiction in Oregon for child abuse investigations? Yeah. Okay, good. Thank you. Any other questions or additions to that? And, there are other states who similarly, and I want to make this point too, that I think is really important for our committee. As we're deliberating about the scope of jurisdiction for Oregon and perhaps considering aligning it in some kind of different way that may be more consistent with other states, we're not saying that there's a difference between being concerned about the safety of children in Oregon and ODHS being the only entity that operates in that space, right? And that's what we really learned from a lot of the other states that we talked to. They also are concerned about this same similar span of our children safe at home, in care, with their temporary caregivers, in any other environments that they may be in. But they have partnership alliances with entities of authority in their communities.
Thanks, bye-bye.
Who can join them in that shared responsibility for child protection. And that's what we wanted to just lay out for you and talk a little bit about. And you'll recall that's aligned with. Hey. Brendan, did you have a question or are you on a call? Maybe on a call. Okay. Remember our values that we've been building over the weeks here, right? Above all, strive to keep children safe from harm. And then down here toward the end, we also have another value about share responsibility for child protection with the community, right? And other, avoid re-traumatization of children in efforts to keep them safe from further harm, and offer healing interventions and seek justice, and reduce disproportionality and of children and families in the child welfare system, and equitably treat all individuals involved in safety determinations with honesty, integrity, dignity, and respect. And of course, maximize the efficient and effective use of available resources. And we're going to look at a little bit of data later on today to really kind of weigh in on how that may be manifesting in Oregon, so that you can use that input as well to consider. But we did want to share with you some of what we learned from other states that we've talked to around how they manage investigations for a similarly broad scope of jurisdiction or concern for safety as Oregon has laid out here. And you can see that, everybody, well, first of all, we should say we talked to, and Sylvia's going to help me with this because I know she was involved and took the lead in many of these conversations with these states. But we talked to Tennessee, we talked to Minnesota, we talked to Massachusetts, we talked to New Hampshire, we talked to Washington, and we talked to Wyoming. Maybe you can say a little bit more, Sylvia, about why those 6 states in particular.
Yeah, we looked at these 6 states in particular because of the states that we researched, these 6 states actually have a broad jurisdiction like Oregon does. They're pretty much comparable to Oregon in terms of the jurisdiction to who can potentially be a perpetrator. Some places it's a little more narrow, but generally most states say it's in-home, for child welfare in particular, in-home perpetrator, familial perpetrator that's in the home. These 6 states were much broader in their scope of jurisdiction as to who could be a perpetrator. So that's why they were selected as states to talked to about their child abuse and neglect statutes, about all of the processes that we're going to be looking at.
Okay. So I'm going to go through these, and please add in here, Sylvia, if you have anything that I missed around, or any details that I missed.
Okay. There's a question from
Brian.
Brian, do any of those states have multiple laws or definitions? None of the states, we could not find any other states that had multiple sets of definitions. All the states have one set of child abuse and neglect definitions.
And the other thing that I think is relevant here for Brian's question is they all identify and are clear about the perpetrators that they're talking about, you know, who the definitions apply to in terms of offenders, right? So it's not that vague statutory language with a definition without that reference in it. So that's helpful as well. And so, you know, all the states that we talked to, definitely, they all have their CPS units investigating, you know, in-home perpetrators, all the familial, that bottom rung of our little graphic that we were talking about. Some of them also will investigate their own, you know, the foster home settings as well, right? Minnesota is one that does that. I'm gonna, these aren't in any particular order, but the other interesting thing that, you know, 5 out of the 6 states have close relationships with law enforcement who investigates any third party allegation. Now, obviously, if it rises, right, to right, Sylvia, even if it rises to the level of child abuse by definition, right?
Yes.
It's still law enforcement that does the investigation there, under the belief that, you know, child welfare is the expert on assessment and intervention in the home setting, and not necessarily any more of a safety expert than law enforcement is in keeping children safe in public, right? Or in settings where it doesn't involve a living situation or the familial environment, or a caregiving, you know, a 24/7 caregiving kind of environment. So, so that was another really important, consistent distinction across these states. Again, it's not that they are not concerned about safety for children in those environments. It's that they have an agreement and a, you know, an arrangement with law enforcement that that's within law enforcement's purview to explore. The other thing that's interesting, which is a little bit similar, you know, this is kind of parallel to Otis in some ways, is that many of them had a special investigations unit within the agency level, which is just exactly what you guys were describing a moment ago, that Otis is part of the agency of ODHS, not part of child welfare. And that's where some of these non-familial, you know, temporary caregiving kinds of situations go. And even in some cases, that's where foster homes go as well, because to avoid that sort of conflict of interest of trying to have the same folks that may have placed the child there do the investigation of any kind of harm allegation in those placement settings. So, you know, teachers, again, childcare providers, foster homes, congregate care facilities, even prominent community members in some of these states went to this specialized unit where it's a little bit, you know, protected and has an ability to more independently investigate those kinds of situations. Employees as well. We've got to list that one, but if the perpetrator happens to be an employee of the department, that would go to that special investigations unit as well. The other area that we saw a pattern in is that many of these states were very clear, making a very clear delineation that their licensing department would investigate child care providers, residential facilities, and even in-home daycare settings. And so if they then discovered in that, it would basically be like a critical incident report or something that would be generated, that would initiate that action. And then, of course, if something rose to the level of a child abuse allegation in the course of that investigation, it would be cross-reported back ostensibly to the Special Investigations Unit, right? Or whatever their equivalent is in those instances. And then finally, Minnesota, we thought it was interesting. We thought there'd be more than this, actually, that did this, but their Department of Education investigates allegations in any education setting situation. And so that goes directly there. And so, given that they're able to really hone in on the sort of traditional scope of jurisdiction for what constitutes child abuse for the children in their states, and then partner with these other entities to ensure safety under, circumstances that are kind of beyond the scope of the family and living situation environments. Sylvia, did you want to add anything, other nuances about this little overview?
I think the only nuance I wanted to add is that when licensing is investigating, in particular the licensing divisions, if they do rise to the level of child abuse, and depending on what it was, I think Leanne said this, they'll either partner with the Special Investigations Unit or with the child welfare investigators on those, depending on what the allegation is and if it actually rises to the level of abuse. But it is screened at the hotline as generally going to licensing if it doesn't appear on the surface to be abuse.
Mm-hmm. Mm-hmm. Yeah, I think Scott's hand was up first, and then Sarah.
Yes, that was, you kind of touched on some of my concerns, was who would be kind of enforcing the child abuse statutes from the licensing agency. So it sounds like it's somewhat like DELC currently has with Otis, where we do tandem investigations. They would be this Special Investigations Unit, as you guys have put in here. So, because I was concerned about that, like the idea of the different units in ODHS, DELC, education, teacher standards and practices, like how their licensing staff would be able to investigate child abuse. Because that's very much an Otis, a child welfare, a law enforcement scope in terms of the actual interpretation and enforcement of the child abuse statutes. So thank you for that clarification. That's something that made my ears perk up here just reading all this, how licensors would actually enforce child abuse statutes.
Right. And one thing I wanted to just related to that, Scott, is that in most instances, we're not seeing the type of incidents like what Oregon identifies, like restraints and seclusion, and some of those in-care allegations are really not included in any of the child abuse and neglect definitions anywhere. They're licensing violations. And so they are, as they come in to the agency, whatever that process is, and usually it's like an incident report, then the agency then takes a look at that at a screening level and refers it to licensing for investigation. But licensing, if they feel that it rises to the level of abuse, then partners with child welfare. So you just don't see those granular type of things included in the abuse and neglect allegations. They're really licensing violations in other states.
Exactly. Yeah. Thank you for that question, Scott. And Sarah.
Hi, yeah, I just think so. We have seen what it looks like when law enforcement's investigating third parties. That is something that has been the case in Oregon, and I can think of many times when cases and kids were falling through the cracks during that time, because law enforcement's job isn't to determine if child abuse exists or even like really if kids are safe. Like they're working to determine if a crime occurred. And child abuse statutes have a very different definition of that. So I can think of like a million different examples, but like one might be that there is someone who, like, let's say there's domestic violence occurring in a home, and statistically that's some of like the most harmful child abuse for like physical and mental safety of kids. But if they're not a biological parent, like let's say it's mom's boyfriend, DHS wasn't getting involved. So law enforcement might get involved, but then if the survivor might not be ready to cooperate with law enforcement, might not disclose anything, then it can't be prosecuted. So then it's just shut. And then kids are still in that situation. And we saw so many cases like that, or cases where there's like sexual abuse concerns and they might be investigated and maybe the child's not ready to disclose, but this person has access to other kids, whether it's their own kids or their stepkids, and those kids continue to be abused. And so before Otis took over some of those third party situations, we would just see perpetrators like go from victim to victim. And so I don't know that I would highlight those things as like better than what we have. I'd be concerned to go back to that.
I think that's really fair comment, Sarah. And I've been thinking about the definition of third parties because of what you're saying, right? Because it's very complicated as to what a third party really is in many ways, right? Because you can have a third party intimately involved in a family home situation. And the example you just described is a great example of that, right? So I don't think we're suggesting here that this is by far and away just because 5 out of 6 states that we saw, has law enforcement investigate third parties. What we also found is that they're very discerning about which cases go to law enforcement. There's not this blanket, sending over the wall a million referrals unvetted to law enforcement. It's things that rise to a certain level. It's things that can't be accounted for any other way. It's things that really don't require the expertise of an ODHS agency level response, right? Like strangers, for example. Like there's no real apparent, it seems like law enforcement is actually better equipped to keep children safe from stranger perpetrators in a neighborhood, for example, than the child welfare agency or its specialized unit might be. So those are the kinds of things that we're hoping that we can explore together about, can we draw any line that actually strengthens the safety of kids and is more responsive to the kinds of circumstances that right now are sort of bundled together without distinction at all. And that can have its own unintended consequences. Sarah Walker, you had your hand up too.
Yeah, I'm really appreciate you bringing this up, Sarah. And I can't speak to the specific experiences you had, but the examples you gave, I think there are mechanisms and have been for those kids not falling through the cracks. So for example, we don't define the significant others of a parent as a third party, and never really have. Like, so the example of domestic violence taking place in a relationship, even if the person who is the batterer is not a parent to the children, if they're going to have access to those children, then that would meet our definition of a CPS investigation if it met the statutory requirement to assign. And for the the third-party sex abuse investigations, if that alleged perpetrator has access in their own home to other children, that would fall under our threat of harm definition to be assigned as a familial CPS assessment. So I think there are safety nets and have been for these types of scenarios. That doesn't mean that there wasn't a specific kind of case and report where for whatever reason it was screened out. But I don't think it's a system-wide, well, like if we made this decision, then we just wouldn't respond to those anymore. I've been with the agency for 27 years. We have always responded to those two types of scenarios. So I would find it surprising if anyone suggested that we change it to a situation where we wouldn't.
Thank you for that, Sarah. And Lindsay.
Just to add a little bit to what Sarah said, there is a very large portion of the third-party cases that Otis does that are internet crimes. They're Snapchat. They're people in other countries who are asking children in Oregon for pictures, or doing things like that. Or there are strangers that are just in the community who are never identified. And I would suggest that we consider like those would be better dealt with by law enforcement, in my opinion.
Yeah.
And those are some of the things that are bogging down the system, where we're unable to identify when children are truly unsafe and provide the services that they need.
Yeah. Thank you for that distinction, Lindsay. Appreciate that. And Sarah Stewart is saying she agrees with that as well. Yeah. Good. All right. So with that, just as a little bit of backdrop, we just kind of wanted to paint this picture, right, as some scaffolding, if you will, for, what could shared responsibility for child protection look like in Oregon, right? If anything different than the way it is now, given that understanding, right, of some of the implications for this broad scope of jurisdiction as it stands right now. And, we just kind of, this is really kind of like an empty worksheet, if you will, right? Of, ORCA still being clearly the centralized hotline in Oregon that's, had great benefit for Oregon to bring all of those reports of potential abuse and neglect into one kind of clearinghouse to make determinations. It's the idea, though, that perhaps there's a refinement as we go to consider the definitions, as we go to get clear about the true perpetrators associated with each abuse type, and refine those definitions further, of, where could some of those screened in reports go for the best response to that safety concern, right? Obviously, still many are going to go to CPS, go to Otis, do some overlap between the two, right? There's already some overlap between Otis and Department of Education, Department of Licensing, potentially, and DELC. I didn't even put on here. I apologize for that. We should add that on here probably, but this is a fluid graphic here. And then there may be some direct stranger law enforcement, referrals that can be made too. I think the thing we've heard, repeatedly is really the need for kind of for precision in terms of the partnership that helps with child protection, right? So that it's a very clear delineation of responsibility and purpose, and how that's supplementing the safety picture for kids in Oregon. And so we're really kind of we're not really arguing about any of the traditional, you know, caregiving, you know, those who have, you know, persons responsible for the welfare and care of a child, and who have care, you know, that direct caregiving responsibility, whether they're even in the home or outside of the home. I think we're talking about the outer edges of this, right? And we're talking about some of the settings in which many of these things can happen, right? And we took this list, you know, really right off of the Otis list, right? That doesn't come back to CPS in any fashion, right? As the sort of the straw person starting point about which kinds of scope of jurisdiction in Oregon, vis-a-vis the definitions, of course, are we talking about? And I think the one that's probably missing, because I don't know that it was actually listed on there, Lindsay, and maybe it's just my omission, but I think third party stranger, right, is the other thing. Because that's true, right? Isn't that a person that we have to worry about?
It's really third-party professionals, its own like subcategory to identify those that might be like licensed or certified in other areas. But then there's third-party other, and that truly captures every other.
That's okay. Let me add that. I'm at the break. I'm going to add that on here. Okay. So imagine in your mind the third-party other is on here as well, right? And so, you know, this really gives us the opportunity then to think about kind of envisioning a picture, if you will, of what this could look like. I want to just go to the chat for a second here. Was there anything else in here, Sylvia, that we need to?
No, there's just dialogue about using whether it's using DELC or licensing agency, and what would encompass that and what would not. So we can figure that out later.
Yeah. Okay. Okay, good. Yeah. This is completely fluid. You got, this is just a straw person kind of starting point. So, you know, what we wanted to try and do is think about, you know, how we might get a subcommittee of folks to come together in our committee here of all of you who have interest and experience, like those who have spoken already and those who've helped inform and shape this more accurately, to really come together and say, you know, is there any refinement to this that would help address some of these unintended consequences that we want to try and mitigate here, you know, identify who would be those appropriate accountability entities in Oregon, right? Who can respond to child safety issues that may be, you know, really not legally outside of the scope right now, because nothing's legally outside of the scope right now, but to suspend reality for a minute just to get something on paper, right, that would posit, you know, who of that list that's beyond the traditional set of things that child welfare typically investigates, right, could maybe be supplemented with tighter partnerships or referral processes under various conditions with some of your other safety partners within the community, right? And so we really want you to just take that graphic and go to town with enhancing it, right, to match those allegations, setting and alleged perpetrator types with the receiving entity that could effectively, consistently, and thoroughly respond to a safety concern about Oregon's children. And we want you to work through like the nuances of, you know, what are those conditions that are really straining the system right now, maybe not getting the outcomes that we'd like to see, and could be better served by different kind of engagement with these partners, and or I think it's going to overlap with our other subcommittee that we want to establish too, which is like much of this could be helped or supported by how the definitions get refined as well, right? So they kind of go hand in hand. But this part is just about who else are your partners here that can really come together and support this process. And so that's the general task. You know, we're hoping to get about 10 members of the group, having a couple of co-leads, right, of key members that could really help shape this and have the knowledge base to do so. And we're trying to tackle this within the next month and a half or so to be coming together and revisiting this then at our February meeting. So Sarah, you had your hand up.
Yeah, thank you. I wonder if it's, and this might go without saying, I wonder if it's also helpful for folks to be thinking about in this context, when thinking about it, you know, identifying appropriate accountability entities who can respond to child safety issues. I think what partners with that is really defining what a child safety issue is, which is what abuse definitions do.
Yeah.
And so it's not so much, hey, with the current definitions we have, who should be doing this? I think it's also, should the definitions be modified? And if so, are there still some things that are risk factors for children that we would want the community to support families around? And if so, who? Because it's not going to be able to be child welfare in those circumstances. It's not going to be able to be Otis. So I think it's important as you're working through this to be considering not only how the structure and who might be accountable for it, but would it even be an abuse allegation, or would it be something else that hasn't yet become an abuse allegation, but there's some risk there. There's some things going on for this child or this family that if they don't get some kind of support, some kind of connect, it could become an abuse allegation. And right now, a lot of our abuse definitions capture those things very widely.
Yeah.
With a response that is meant to capture safety. And I think that's what you're going to see in the data you're going to see today is we're responding to a lot of safety concerns that are really risk
concerns,
and using a resource that's meant to respond to safety, to respond to risk, and that resource doesn't have the appropriate avenues to really respond to that risk well.
Yes. Yeah. I like that refinement, Sarah. That's really helpful, actually, right? So this task might really be who can respond. I mean, at this juncture anyway, because I'm hoping we can run these subcommittees kind of in parallel, possibly. I don't know. But if you think about it from a risk reduction mindset, right? These entities may become more clear, right? And then we really have to stay closely aligned with how we're teasing out the difference between those risk and safety issues over in the definitions subcommittee as well, right? Yeah. Other comments or what? Oh, let me see. I think I have.
I think, Leslie Ann, can we just go back to the graphic just for a minute, and just wanted to make sure that we're clear as
Oops. Not that far.
No, not that far.
Sorry, I'm going the wrong way. Hold on. Why am I not going back here? Here we go. Back.
This one, yeah. So just so we're clear, because there's been so much discussion about the, making sure that the appropriate people are looking at child abuse and doing those investigations. If you see in these boxes, there's this crossover between CPS and Otis. There's this crossover with Otis and Department of Ed and Department of Licensing. And based on today's discussion, there might even need to have this little bit of a crossover between law enforcement and CPS, right? So there's as Sarah was saying, there's a process for screening these as they come in and making decisions about what best suits law enforcement, but sometimes it might be a joint investigation. And so both entities are partnering together to do that investigation. Same with maybe it's a Department of Ed, but there's also a crossover to Otis, and there's this time where they're partnering together. So it's not exclusive of that opportunity to partner when you're supposed to partner, and when it makes sense to partner, and when allegations necessitate that, if that makes it a little clearer.
Mm-hmm. Good, thanks.
Just
Zoe.
offer one more clarification, because I just want to make sure folks in the committee understand. ORCA does not decide what reports should or shouldn't go to law enforcement. They all go. There's a law in Oregon that both law enforcement and ODHS follow, a cross-reporting law. So whether we assign or closed it screening a report, it gets sent to law enforcement. And they decide if and when and how they're going to respond. And if we are also assigning a CPS worker, that's when the partnership happens.
So that would be some important information to tap into, is when everything gets reported, what are some of the impacts of that, right? In terms of prioritization and clear criteria for what is really being asked of law enforcement. I don't know if there's been any look at that in the data.
I think every law enforcement jurisdiction responds, sets their own decisions about what they're responding to. But I think in general, they're responding every time a crime is potentially alleged. So it may be closed at screening for us, but if a crime is alleged in the report, they're responding to that. Or it may be an assign for us, but if there is no crime alleged, they may choose not to respond. I know some jurisdictions respond to everything, so but that's, their role is very different than everyone else on this chart. Their role is, just about investigating potential crimes.
Mm-hmm. Mm-hmm. Yeah.
But I imagine it is, if everything is being reported to law enforcement, it's a workload for them too, to go through every single thing. So, I mean, we've heard from other places. I mean, I just know from my own experience in California that used to be the case. But you just have this mountain of cross reports that are coming across. And so it's a workload issue for them, I would imagine, as well.
Brendan.
Well, I think it's an oversimplification that law enforcement just investigates crimes. The reality is Oregon law requires in child abuse investigations that they're co-investigated by both DHS and law enforcement. So frankly, respectfully, this graph is way underutilizing the crossover between law enforcement and CPS, because both have to do co-investigations, and it's up to the district attorney to be responsible for developing county child abuse multidisciplinary teams that set forth when the procedures and what those procedures are for co-investigating. So there's another layer of sort of cross-coordinating effort to make sure children don't fall through the cracks. We're interestingly talking about doing the exact opposite of what child abuse policy has been in Oregon for a long time. When we talked about co-investigating, multidisciplinary teams and responding and then figuring out what we have and then making determinations about who the appropriate entity is to follow up and provide services to the family, versus sort of figuring out at a screening level what we have, is it abuse, and then pushing it off on a different partner. So this diagram, while I understand what the intent of it was, it actually vastly underestimates the structure around Oregon law on how the law requires law enforcement and child abuse, DHS, child welfare, to coordinate and to co-investigate allegations of child abuse, which is the very thing we're talking about, is what is the scope of those definitions. So law enforcement may also respond to things that aren't necessarily just, we think there's a crime here. It could be, no, we're very concerned about the safety of this child. And then when they get there, they make a determination, of course, it is not potentially criminal, but we need to refer it on to someone else who can follow up with that family. So I look at the way, in practical real world terms, right? SROs, school resource officers, are sucked into situations with school districts when school personnel are concerned about whether or not the child has appropriate clothing. And they're having these conversations in theory and under best practice with appropriate kind of partners to address concerns that individuals may have. So I just want to kind of plant a flag in the sand that we're kind of doing opposite of what has always been the intent of child abuse investigations, which was to co-investigate, figure out what they have, and then partners make determinations about sort of who the best individual entity is to follow through on the different concerns that the investigation shows are present in a family.
So I just want to say, I think, to one thing I think we want to keep in mind is we are saying this is not what it looks like now, right? What we're trying to say, what it could look like. And we've already had a lot of dialogue about where we would need more crossover or and we're not trying to present what it looks like now and change the law. And we don't know what the current landscape looks like across the state of Oregon. That's part of what we're finding out. So when what the law says be very different than what's actually happening. And I think that's important for the committees to keep in mind as we move forward, because the law may say that a MDT needs to exist and needs to set their own rules, but we don't even know if that is actually happening in every district in the state of Oregon. That's something we still need to explore, because that's part of the committee's task. So I think sometimes we just need to keep in mind that what the law says isn't just always what's in reality happening. And so we need to think about what both of those are bringing to the table and really look at where can we go from here.
And I think Amelia's hand was up, and then Buck.
Hi, all. Sylvia just said basically what I was wanting to chime in on, is that it's not happening in reality that way across a lot of Oregon. And like, even just when we're talking about the cross-reporting to law enforcement, like, I think there are some law enforcement jurisdictions that have a really great process in place for that. And then, like, we have some jurisdictions in our county where, there's like one officer on duty, and then there's a stack of things that arrive on the fax machine that they're not able to review because they're out in the field. And so unless our local DHS office is calling directly to dispatch and saying, hey, we need this officer to pay attention to this, it's just not coming to the surface. And like, sometimes, we'll reach out and say, hey, this was cross-reported to you, and they'll be like, oh, I didn't see that one. And then they'll go dig through the pile and pull it out. And, it's just not, it's not a very functional system with the cross-reporting. And it puts in our rural counties, it puts it where law enforcement is often behind, right? Because DHS will get that they'll get that report and they'll just go out right away, and they won't wait to collaborate with law enforcement and go out together, or law enforcement's not available to go out together. And then that collaborative process, you know, that we were just talking about, that, you know, should be happening, isn't. And then law enforcement is in that position where they have to play catch up, or, you know, maybe the perpetrator already knows that there's an allegation of abuse, and so that makes investigating those cases even more difficult. And you know, I know that fixing how cross-reporting works is not necessarily our, you know, charge, but I really want to echo what Sylvia was saying, is that, like, you know, there is this ideal, and then there is, like, what happens in practice.
Right.
And I do think that MDT model is so critical, and something that we need to kind of keep at the core of what we're doing.
And that is in our scope, Amelia.
Yeah.
So yes, exactly. Yeah. Thank you for that. Appreciate it. And Buck.
I just wanted to both agree with both sides of that. Is there is a tremendous workload for law enforcement. We look at cross reports daily, and so even at that level where we're filtering, making decisions on whether we're going to act on a cross report or not, that does provide some sort of involvement even at the level from police. Like you were saying, Sylvia, that takes a lot of time and is definitely resource heavy. And then law enforcement, we don't have the luxury of deciding whether we investigate this crime or that crime. We are charged to investigate everything, and not just child abuse, but everything under the sun. And so our workload is tremendous, and that sets up the foundation for the extreme importance to work with CPS and other professionals in investigating child abuse, because we're certainly not experts. And that is the best practice nationally, to conduct child abuse investigations jointly. And I think the primary reason why that's best practice is so that ideally the kid only has to tell their story a couple times versus a lot of times, and we've seen the effects of that, and so that's why we have MDTs. That's why we jointly go out with CPS workers to investigate these cases, or Otis, or anybody else in these cases. And so yes, law enforcement is involved in everything in this chart, and rightfully so. I would agree to that. But I think, as has been mentioned, it's just a lot of work that's been set our way. So that's all I wanted to say.
Yeah, thank you for that from the law enforcement perspective, Buck. That's helpful. And Nicole.
Yeah, thank you. I have an addition to this that is not regarding the overlap between law enforcement and CPS. And so I put my hand up to make sure I didn't get lost, but I want to make some space here if there was anyone else who wanted to say anything regarding that conversation we were just having. I feel like, Bren, you might have unmuted again and then remuted, but happy to jump in if we're ready to move to a different part of the conversation.
Thanks. I just wanted to really quickly say I agree 100% with what everyone's saying. I know it's a patchwork quilt of quality as we roll it out, but again, the decision point before us very much boils down to, statutorily, do we define from the beginning who does what, or do we require both agencies to lean in and then try to figure out what is facing a family? That's really what it comes down to, is at what point do we shift these concerns into different systems? And I think that's the part that that's the problem with co-investigating. It's the problem with MDT statewide. It's very different involvement depending on where we are. But ultimately, when is it appropriate to make a determination about who determines the safety of a kid. Oregon law for a long time has said we don't do that until after an investigation has occurred. And that's why we co-investigate, and ORCA screening can do as best it can to figure out if it has enough. But I think that's just, I'll kind of stop there.
And I just want to check, Nicole, if you don't mind, Sam, because you're representing law enforcement too. Did you have something to add to that same thread?
Well, it makes me really think about what we have going on right here locally right now. And I don't know about down where Buck's at or some of the other counties, but we are in the very early stages of the formation of a family justice center here. And when you're talking about recommendations, you know, those are things that rather than every county in the state of Oregon or counties having to merge together to put something together, if that's something legislatively that there's support behind creating that family justice center model throughout the state, it eliminates a lot of the concerns that we're talking about right now, which is the volume of cross reports that get emailed and faxed back and forth instead of everybody working independently and then having to try to get their notes together. Everybody's physically together and the kid just comes to one place, and it simplifies a lot of the back and forth. Certainly that's not going to be the answer for everybody, and that's a big lift, especially in some of the rural counties where financially, you know, you're talking about overhead and personnel, but I just really, it makes the argument to me stronger as part of our Family Justice Center Steering Committee why that model is so successful in other parts of the country.
Mm-hmm. Mm-hmm. And yeah, is that kind of similar to a child advocacy center, kind of like one co?
Well, it's combined.
Located.
CAC. You also would have CPS, law enforcement, dependency. I mean, you have it all. You have remote court. You can have protection orders filed and appear virtually in front of the judge, all in the one location.
Mm-hmm.
You have, you know, self-sufficiency. You have counseling. You have childcare. You have food service. I mean, it's bringing everybody that currently runs their own facility independently under one roof.
Mm-hmm. We'd love to hear more about that, Sam. Yeah, I'm going to follow up with that. And so, Nicole, go ahead. Thank you for being patient.
Absolutely. You couldn't have set me up better, actually, Sam. What you just said is so relevant to where I was going to go next. So first, I have a question. With this graphic, it looks to me like most of what we have listed here is what happens after it's been screened in, right? After ODHS has said this is a concern we want to, okay, great. So I've got some insight into some of the things that are happening with those that are screened out or closed at screening. And I think that that would be really important for us to name because there's some development work happening there around pathways where we can get families connected to community-based resources, right? Instead of not having anything available to them because it wasn't screened in. So I can start there. And then I also want to come back to this family justice center concept you just named, Sam, and just mention some work that we're doing around the development of family resource center networks in Oregon. So first off, the piece about calls that are closed at screening at the hotline, those that don't rise to the level of safety concern. There's currently work happening with the opt-in initiative that's being funded by the Doris Duke Foundation. We are a part of that work. And what we're trying to do is we're looking at two models that currently exist. There's one in Multnomah County. That's it's a pathway that exists for the hotline to refer calls to LifeWorks Northwest if there is not a safety concern. And then in Klamath County, there's a pathway for those calls to go to the family coaches and self-sufficiency if there's not a safety concern. So what we're doing in that opt-in initiative right now is we're looking at what does it actually mean for us to be able to replicate and perfect those pathways so that those calls that are closed at screening can go to community-based organizations or other programs that can support kids and families outside of the state or within self-sufficiency. So just to make that connection with the opt-in work, I think it's really important that we're paying attention to what's happening in that committee as well, because I think that that's going to have an impact on what we are able to do in terms of moving referrals to other places besides the state CPS response. The other thing I want to name, right, like I mentioned about the FRCs. So we are currently in the process of exploration around the Family Resource Center concept in Oregon broadly. So we're looking at it from the prevention side of things, right? Prevent Child Abuse Oregon is really, really upstream, where we are super focused on the conditions, the systems, trying to actually change the environment that our kids and families are living in to allow them to thrive. So for us, we've gone through a process for the last 2 years of investigating the Family Resource Center model nationally and really looking into what are the benefits of that co-location, bringing people together to provide services and resources to kids and families in a community-based way, right? Community-driven, community-led, and outside of the state response system. So I just want to name that work is happening. We are in that exploration phase still, but we are absolutely moving towards being able to start building towards this and working towards implementation. I think it's a little different than Family Justice Center that is focused on that kind of response mechanism and the coordination pieces that come after there's been harm. So, you know, it's not 100% the exact same thing, but it's very, very similar. And I name this because these coordination attempts, right, as we are thinking through what does it look like to get kids and families connected to support that is not just child welfare, a lot of that is going to be a connection to community-based organizations that currently there's not a direct pathway to get those referrals to. I'm going to stop there, but it felt really important to name that this work is happening on the community side of things too, even if it's not super visible yet.
Well, and Nicole, I'm glad you said that, because one of the very things we'd like to be doing, theoretically, while these subcommittees are exploring these topics, is we're talking to those prevention points of contact and really pulling together to present back to this committee what does that, as it informs our alternative pathways recommendations, right? Because that's what you're talking about, is what is the infrastructure that's building in Oregon to be able
Absolutely.
to receive that sort of referral and all of that. So everyone is absolutely correct when they say everything is connected to everything else. And, you know, I think that's where it doesn't feel perfect to dive into a certain area without talking about some of the other connected areas. But I think if we can start all of these conversations, we can still continue to loop back with each other and reinform this, that, you know, these are not done deals by any point at this point. We're just trying to start conversations of exploration here. So, okay, so I think that caught all of our questions. I want you guys to just think about this idea, right, of the task at hand, knowing that we may have some other elements here that we want to bring into it or consider for it as we move ahead. But we're a little bit over time here, so I want to move ahead to this very related issue that has to do with the definitions, and see if we can't get through some of this data that we want to look at here before we lose Roy. So Sylvia?
All right, so we are going to come back to the discussion about the committee formation, but we're going to do this part first. So we're going to do a little bit of exploration of this vague threatened harm definition, talk about the lack of a comprehensive neglect definition for Oregon and the absence of the poverty exception and neglect. And then we're going to show you some data to kind of help get us where we need to be. So that's what we're going to focus on next. So as you know, Oregon has a vague threat of harm definition, and the prevalent use of this threat of harm abuse type much more than other states, right? But for the purposes of understanding that, it is very vague in terms of what it means. What does threat of harm mean? And much of what I think is in practice is included in threat of harm, not in the definition of itself, but in the practice is what is other states typically include in their neglect definition, and sometimes even their physical abuse, rather than considering it as a distinctly separate type of abuse. Excellent. So this is the threat of harm to a child means subjecting a child to a substantial risk of harm to the child's health or welfare. Once again, and I think it goes back to what somebody said earlier, is are we focusing on safety or are we focusing on risk? And then, so what we see in the italics here, the threat of harm allegation is reserved for use at screening when the reported information doesn't identify another abuse type. And when the abuse to the primary victim results in harm or a threat of harm to the victim or to the other children in the home, and then there's more discussion about physical abuse, sexual abuse, neglect, domestic violence. This italicized language is really what structured decision making has created in order to provide guidance to the screeners at the hotline. So if you remember back to Sarah's presentation about the screening function, they have Evident Change come in and created some guidance for them to use in their decision making, in their screening process. And they developed this additional language to kind of give some meat to this vague threat of harm definition, because otherwise it's like, what actually fits under this threat of harm definition? And it's so broad, it's so vague, nobody really knows. So Evident Change tried to create some meat for that definition, and that's what they put together, is what you see in the italicized portions of that. So this lack of comprehensive neglect definition in statute is really, it complicates, I think, just having a clear set of guidelines for how people are going to investigate this issue of neglect, including this threat of harm. In addition to the neglect statute itself, there are 3 additional statutes in your statute that identify harms that we typically see in other states under neglect. We typically see these same areas under the neglect statute. And in Oregon, they are separate statutes. You see them below: buying or selling a person under 18 years of age, exposure to methamphetamine manufacturing or controlled substance manufacturing, and unlawful exposure to a controlled substance. In Oregon, these are 3 separate statutes, which are usually included in a neglect statute in other states. It's unclear to us how these are accounted for in our reporting data, because when we look at the data for Oregon, we don't see these anywhere. We don't know if they're usurped into the neglect area, or there's just no accounting for these 3 different statutes in Oregon's child welfare data at all. And so we really wanted to be able to take a look at this threat of harm vague definition and this neglect statute, and see if there's a different way we can work with this statute.
So Sylvia, I just want to mention in the chat that Leslie Lanier is indicating that those 3 things are counted under neglect in the data.
Okay.
But we wouldn't know that, right? Because you can't report on them independently, as far as we can tell, right? Okay, thank you. Go ahead. Let me advance.
Yeah. The other thing that Oregon doesn't do is they don't differentiate neglect from conditions of poverty in their definition of abuse or neglect. So many states have an exception of some kind for poverty. Below this box, you see that Oregon's definition of neglect. It's the negligent treatment of a child, including but not limited to the failure to provide food, clothing, shelter, supervision, protection. That's generally the broad definition of neglect in most states. And then they go into some details about what is all included in neglect, but there is no, and then there's usually some exceptions, and we will be providing some examples of those, but there is no absence of poverty exception for neglect in the Oregon statute. Yes, Sarah.
I just wanted to clarify, this definition is from the structured decision-making tool. It's not actually the statutory definition. The statutory definition does not include supervision or protection. That was added into the SDM tool.
Oh, I wonder, okay, yeah, it should be italicized. Sorry about that. Yeah,
Okay.
yeah. Thank you, Sarah.
Thank you. All right. So this is some data that I think we've seen already. This is data that Sarah presented to us. And as you can see here, the threat of harm and neglect are the percent of incidents here. The largest number is threat of harm and neglect, right? Each type of abuse is experienced by an individual person, a victim, and it counts as one incident as child abuse. But the number of incidents is actually larger than the number of victims because the victims could have suffered more than one of these, right? So you could have a threat of harm and a physical abuse and a mental injury, right? So the threat of harm is the largest category here at 48.7%, followed by neglect at 27.8%. And these are of all incidents of abuse during the fiscal year of 2023, which is the most recent year that we have still. So according to structured decision making, what's included in threat of harm includes things like what we saw in the previous slide, the physical abuse, and some clarification around there, domestic violence, and some clarification around there, some clarification around sexual abuse. So little clarifications that help the screeners in deciding what allegations to send forward to their investigators. So the SDM really provides that clarification for the work itself as they're moving forward in their investigations, if they're moving it forward for investigation. You also saw this data from Sarah that shows the total of investigation dispositions by founded, unfounded, and then I think we clarified it wasn't unable to locate, it was unable to determine. That was the pink part. So if you look over to the right, you see that there are 5 years worth of data, and what you see here is the large numbers of unfounded allegations in this work. So if you look to founded threat of harm has the largest numbers of founded. Neglect also has large numbers of founded, but if you look at this chart, if you look at the colors of the chart, the unfounded is a huge amount. So we're really looking at, what amount of resources going into looking at these neglect and threat of harm, and how many of them are being unfounded because of the lack of clarity, the vagueness of this definition that doesn't really help to identify clearly what is happening to that child that is within those definitions of safety for that child. So now we're going to look at some additional data to guide our work. We're going to look at some dispositions by abuse type, neglect, and threat of harm by race and ethnicity to see how that is impacting your communities of color in Oregon, and proportions of abuse type by region. And Roy is going to walk us through that. So Roy, welcome.
Thank you. Hello again. As I said, Roy Smith, he, him pronouns. I'm a data analyst with Child Welfare Strategy Innovation Office. And I was asked to show some allegations type data and their dispositions. And so as Sylvia mentioned, we'll look at a few different views over that about this data. So we're looking at CPS reports. This is all allegations, and predominantly we're showing our founded, unfounded, and unable to determine Unless otherwise noted, there's a couple of charts where we're not looking at just those three or a combination of those three. And this data we're going to be looking at goes back 12 years, although in most cases we're not going to look at all 12 years, but we do have a couple where we want to show some changes over time, especially as we try to talk about changes that occurred after legislation resulting in those more specific in-care types, those definitions. Sylvia, would you mind going to the
Yeah, I got you, Roy. Next slide.
Or sorry, Leslie, thank you.
Yeah.
Okay, so our first chart here is showing our dispositions by allegation type. We're showing both the count and the percent. And if you'll note there at the top, we're looking at 2012 through 2014. So this was, as I said briefly just a second ago, this is an attempt to show allegation types prior to the legislation that occurred about 2016. And so what we have here is state is going to be all of the allegations that were founded, unable to determine, and unfounded. And so then within their allegation types. And so, for example, we would look at our neglect category, and we would say that there were 18,931 founded allegations of neglect for this time period. That then accounts for 12.1% of all of these dispositioned allegations. So we're talking about looking at the chart and just kind of in the back of your head, understanding that all these percents are going to add up to 100. There's actually probably going to add up to like 99.99 because there's decimals not shown, but we're showing all of them broken down by their allegation type and then whether or not what their disposition was. So main thing here is to kind of reiterate what was said earlier, is that our neglect and threat of harm still far and away are most, and then of those, obviously unfounded far and away are going to be the most that we see here, both count and percent wise. I have a note to myself, and I realized I have my note in the wrong spots actually for the next slide, so I'll ignore that. So can we go to the next slide?
Yeah, Brian, did you have a question about that slide, or this? This is a similar set. Yeah.
Can you go to the previous slide for a second?
Yeah.
I just want to make sure I understand. So, for example, with threat of harm, there were 29,852 unfounded, and so it's roughly these three represent 100% of the threat of harm cases, and there's a higher percentage of finding there than any of the other ones, it looks like.
What we'll do is that the next slide is going to show what you're talking about, because we're going to compare stats. Here's where we have our 100% stack chart. The previous chart that you were just looking at is showing out of all of the allegations by their disposition, not tied to each other. Here, for example, you'll notice that the counts are the same. So for example, you said threat of harm was 29,852. There it is right there. So there's the count of 29,852 unfounded threat of harm, which of all threat of harm allegations equates to 55%. 55.3% were unfounded versus, sorry, I gotta get my screen so I can look a little bit better. Versus 17.1% were unable to determine, and 27.6% were founded. So we're just comparing threat of harm to itself in here versus on the previous chart it was showing all allegations together.
Thank you.
So this is the same data, and it's just giving another view so that you can look at a given allegation type and kind of compare proportionally what percent are founded or unfounded over those allegation types. Same time period, 2012, 2014, again, to try and show what our allegation types looked like prior to legislation that occurred. Next slide, please. Thank you. So now reorient yourselves again. This is like the first slide. We're showing all of the allegation types. And now we have jumped into the future. It's now 2020 through present. And so we're now able to see all of the different types of allegation types that have come into being as a result of the legislation that occurred in 2016. So anywhere we're looking at a type that says parentheses in care, end parentheses, we're talking about our 418 types, excuse me. So comparing the prior to post, we're seeing a whole lot more types, but it's still predominantly falling into our neglect, threat of harm, physical abuse, sexual abuse categories.
And Roy, the one thing I just wanted to share with folks about this is that the legislation came in way earlier than 2020. However, it took a while. It took a while for the agency to get geared up and in a position to report that data. So that's why it's starting at 2020 to present.
Yep. Right. Because we did this a little bit earlier, and we commented on it too, Sylvia, if I recall. We looked at the fact that, we know in 2016 this was occurred, but you didn't see the changes happening until much later. Yes, thank you for pointing that out. So the next slide again does the same thing, where we're now going to just look at each individual allegation type as a percent. And so the counts are going to be the same as you saw on the previous slide, except now the percents are the percent of each column. So 140 plus K unfounded neglect equates to 73.3% of all of the neglect allegations for 2020 to present, versus only 18.8% of them were founded. Where there are not numbers, it's just a fun feature of Power BI, not telling me, hey, you can't fit data labels in here because it's too small. The space is too small, so I apologize for that. I see is there a question here from Chris. Are neglect and threat of harm often seen on their own as alleged maltreatment? And Sylvia already answered. Thank you, Sylvia. That would not have been a question. I think I would have been able to answer.
So is that what you find in Oregon, Leslie and Sarah as well?
Yeah, they're often on their own. I mean, if we have an allegation of neglect in the home for one child, it's generally true for all the children. So if we have an allegation where it's not neglect, but it meets the threat of harm neglect, that really is a situation where maybe we don't have neglect happening yet, but the conditions, circumstances, behaviors are such that there's a substantial risk of that. And so then it's threat of harm neglect. We actually coach our screeners not to choose two allegations that includes threat of harm and something else, unless it's something like there's an allegation of sex abuse involving one child in the home, and then we're also alleging threat of harm for sex abuse for the other children in the home. That can happen sometimes. Or if, say, there's an allegation of physical abuse, but also there's intimate partner violence taking place in the home that's putting the children at threat of harm for domestic violence. So it can happen. I don't know that we have data about it, but we try to not over allege for the same, we don't want to add multiple allegations to a report for basically the same circumstance.
Right.
That was the part I was thinking about, Sarah. Thank you.
That was Chris. Okay. And Brian, I know you have another question. I'm just cognizant of Roy's time because he needs to roll off at 3. So go ahead.
I forgot to lower my hand. Sorry.
Oh, that was from before. Okay, no problem.
Okay, thank you, Leslie. And you move to the next one. So this was the last one, kind of under this category where we're looking at dispositions by allegation types. This is just one more way of looking at the change over time for allegation types. So down at the bottom left, we're starting in 2014 and we're moving until end of 2024. And so you just see how allegation types have changed over time. These are all founded, and just give you, because some of these colors might not be so easy to translate from the legend, but kind of this salmon type color at the top, and I'm terrible at naming colors, so if I say something just ridiculous, call me out and I'll learn something. But what I thought looked like kind of a salmon pink color at the top, that's your threat of harm. Underneath that, the kind of the pale turquoise color is sexual abuse. Then below that is the pale green is physical abuse, and then the large bright blue at the bottom is showing neglect. So you can see how some of the categories have shifted in terms of their percent of the total founded for each year. The extra categories are super hard to see because there's so few of them. But for example, we're looking in down at the bottom, kind of 2022 and beyond. We're looking at that dark color being your mental injury at the very bottom, and then the kind of the little sliver between the green and the blue, starting about 2020, is neglect and care. As you continue to move right, it might as well be black for my eyes, unfortunately, but it's a very, very tiny number and percent as that category was introduced. Okay, so we had an ask then to we're going to go look more specifically at neglect and threat of harm, and so we're going to look at it by race and ethnicity breakdown. And so this chart shows the cumulative last 5 years of founded threat of harm and neglect allegations, and we did go ahead and combine neglect and care into the larger neglect category here. And this one reads left to right, just like the legend does at the top. So we have our American Indian and Alaskan Native population in the dark blue, our Asian population in the kind of, I don't know, what do you call that, periwinkle blue, and our Black African American population in the very light sky blue, maybe. I might have those backwards.
That's good.
Then Hispanic population, our Native Hawaiian and other Pacific Islander population. If no race was selected, and we unfortunately have a lot of that. We have a lot of holes in our race data that we keep working to fill in. And then our white population is the gray on the far right side. Count and percent of the whole for both neglect, which includes, as I said, neglect and care, and threat of harm, founded allegations for the last 5 years, so 2020 through 2024. Moving on to our next chart. So the ask was to, it's one thing to kind of just talk about numbers. Let's look at how they compare proportionately. So we have a disproportionality index chart here. So this is showing the same last 5 years as the previous chart. It's showing the same populations, and it's showing the same neglect, which includes neglect and care, and threat of harm. So to orient yourselves, neglect is always going to be blue on this chart. Threat of harm is going to be red. This then shows the average disproportionality index for the last 5 years for each race ethnicity by neglect and threat of harm. And probably most folks are familiar with this proportionality index, but I always have to remind myself, and so it's calculated by taking the percent of by race of a children youth at a given decision point. So in this case, we're talking about our allegations that are founded, and then dividing it by the percent of that same race in Oregon's child population. So when we end up then with a value that's less than 1, we are underrepresented. A value over 1 is overrepresentation. And one's proportionate. So it's basically saying proportionately to the Oregon's population, the same amount, roughly the same amount within the smaller population when it comes to these founded neglect and threat of harm allegations is the same. Oregon population data that we used is only for children and youth who are 18 years old and younger. And so the data for these allegations has similarly been filtered to exclude children older than that. And another key piece of information here is that because we don't have 2024 Oregon population data yet, 2023 population data was used for 2024. The same data as it relates to reports made rather than founded. That is available. I don't have it set up for me right here, but yes, that I can take BI and I can unfilter for just founded and then rebuild my table. So we could talk about if that was a helpful ask for this group going forward.
I think the question is reports made. So
oh, sorry.
If you're really referring to the number of reports made to the hotline, no, we do not have that data.
Thank you for helping me.
Mostly
clarify.
because at the hotline, we can't verify the race of a family. A reporter might tell us they think a family is of a particular race, but we don't include that. We narrate it. We don't include it in the data because unless it can be verified, that could be inaccurate data. So while Roy could give you the breakdown of founded versus unfounded, we can't tell you how many families of a particular race are reported to us.
Thank you, Sarah. I interpreted that as all of the allegations that I had as opposed to.
Yeah.
Is the point of founding the first point at which you do know the race and the other demographics?
Is that the first reliable point at which you would know the race is when it's disposition, do you think, Sarah? Or
no, the reliable point is when ODHS make contact with a family and the family verifies their race. So that doesn't just have to be through child welfare. That can be a family that interacts with our self-sufficiency program because we can pull that data. So if a family interacts with self-sufficiency and verifies that their race is white, and then later, if they are reported to the hotline, we would pull in that data, and so that would be included. But when it's a family that's never had any contact with ODHS in order to verify their race and ethnicity, it shows as unknown. And you saw even at CPS assessment, there are a lot of unknowns, and in screening, it's an even larger proportion of our screening reports show unknown for that reason.
Thank you.
Okay, so if we could move to the next slide. So the previous one was showing an average for the 5 years. What we're looking at now is each year's distinct disproportionality index by race and ethnicity for the neglect and threat of harm categories. So there's a lot going on here on this chart. I did my best to group populations together by similar colors. So in every case, the darker version of the color is going to be the neglect category for that race. And the lighter version of that color is going to be the threat of harm category for that race. And so now instead of having just one disproportionality index as an average for each race. We're seeing each year, each race's disproportionality index for that given allegation type. So just another view to be able to look at over time. And I do want to state again that for 2024 disproportionality index, we don't have Oregon population for 2024, so 2023 population data was used to make that calculation.
So Roy, just to be clear, these like 4s and 5s and 3, you know, ones that are really high here, what is the statement that is the equivalent narrative to say what that actually tells us? I mean, like for 2024, a Native American child in Oregon is 6.2 times more likely to.
I wouldn't say times, because in that case we're talking about a disparity ratio.
Yeah.
Which is used uses this data to calculate. But the disparity ratio would only be calculated if we were comparing this population to the very previous decision point, and we're comparing it to just straight up Oregon population. So what we would say is that on the index there, for example, American Indian, Alaskan Natives are significantly disproportionately represented, and they are at a, you know, for 2024, they're at a 6.2. But you wouldn't say that they were that times as likely, if that makes sense.
Okay. I'm just not sure if these are standard deviations. I just don't know what the metric actually is here. Sarah, do you
Would
know?
it mean, I wonder, Roy, I don't know if this is accurate, you tell me. Would it make sense to say for, so if you have a population of 10 white children in Oregon, what this data tells us is one of them will have every year a neglect allegation and a threat of harm allegation. Whereas if you have 10 Native American children in Oregon, 6 of them will. Is that a way to think about it?
So because it's a comparison of two ratios, right? And so I know I'm not doing an excellent job of describing how to. I probably should make sure that I have the correct statement. And so
No, it's okay. I just want to get deeper into this data later, and I just love to know, like, what is the language that it tells us specifically, because I think the other thing that's important is the disparity piece, to say how much more likely than a white child, right? Are any of these ethnic groups going to experience this, right?
And that is calculated essentially by using your white population as
the benchmark, kind of, because
and
they're at
everyone
one.
else is compared to that. Yes.
They're representative, whereas these are disproportionately represented.
Correct.
Yeah.
Correct.
Okay, Brian.
It's not predictive of how many you'll have of any particular race. It's about how many cases were there overall, and breaking down those cases by demographics, and then the proportionality of each of those based against the proportionality of overall demographics, right?
Yeah.
And so that's really what it's showing, is showing that each year this is, you know, what we would predict to see, as far as if everything was done in a way that across the board, everything should be at ones, basically.
Yeah, right. Because they'd all be representative.
They're not. So yeah. Okay.
Mm-hmm. But I'm just trying. I know higher is bad, but I'm just trying to figure out how bad.
You want to be able to make the statement. I understand.
Yeah, right.
I will find the correct way to state it and get it to you.
That's good. Thank you. Sorry to split hairs there, but I just want to be clear if we're gonna.
but each of those is a magnitude. I mean, right? It would be that if you've seen a 5, it's like they're 5 times what you would predict if all factors were equal and race.
Yeah,
weren't a factor,
exactly.
right?
That's why I was doing the times thing in my head, but I still don't know exactly what that means. Yeah. Okay, this is helpful because I mean, clearly it's telling us that there's an awful lot of disproportionality going on.
And that it's, the comment I made is that it's flat, right? It's also showing that almost across the board, these numbers are being replicated year
after year. That's exactly
we're not
right.
seeing any significant change in the disproportionality.
That's right.
It's pretty much the same. But again, the thing that would be helpful is that if we could see the point at which that disproportionality starts. So this is on the founded side of it. Where does it begin? Does it begin with the reporting? Is it, is it part of the screening and so forth? That's why I was asking that question. I understand the limitation based on the way the process currently works, but it makes it harder to see, to draw a causal relationship here is difficult without having that other data.
Yeah.
And I think that Sarah Walker, I don't want to put you on the spot, but to me that goes to the idea about over-reporting.
Yeah, it does. I think the conclusion you can draw from this is based on national research, no population of people abuse their children more than others. This data makes it look like some do, and now research indicates that's just not true. And so for some reason, and there's probably multiple causes, and I think the question you are all tasked with is, are the definitions of neglect and threat of harm part of the cause? For some reason, these particular populations are getting founded dispositions on neglect and threat of harm way more than they should and way more than other populations. Are the definitions themselves one of the factors?
Right. Exactly right. And given that we know that the vagueness of those definitions seems to have jumped out at us, right? That they are the vaguest of the definitions, perhaps that opens the door for our implicit biases and other factors to seep in. Who knows, right?
Do you have this? Do you have this with other demographics besides race? Do you have it for students that are experiencing a disability? Those type of factors, because it'd be interesting to look at that as well, given especially because the vulnerability that we see and the over-identification and by race with that too. So
yes, the question is, do we have that data this early in the process?
Right,
do you know what I mean? Like those in some of the
intersectionality.
Yeah.
Right. Yeah, and some of it is there. That, for example, we could look at age groups and we could make some assumptions about education. But for example, having financial type information, so we could get an idea of what poverty may or may not look like, and if that has has a piece in it as well. I don't have that available right now. No.
Yeah, I think it'd be good to look at, but also something to be careful about how we tread with that as well, just because it can become a thing where blaming culture, which it's not, right? But we want to be cautious, but it would be helpful to see that.
Okay.
I am running over. I have a meeting I have to go to, but I've got one more slide.
Okay. Sorry. Let me get you there. There we go.
So there's quite a bit going on this one as well. But the goal here on this chart is to show, now we're looking at unfounded. So shifting gears from founded, we're now looking at unfounded allegations by type and county population grouping for the last 5 years. So Leslie and Lanier and I spent some time together trying to come up with some ways that we could show differences in allegation types across Oregon. We have statewide, we could do by district, we could do by county, by branch. we could group those in regional ways. We could try and look at urban versus rural. I was looking at what the definition of urban versus rural was, and was kind of mildly surprised, at least the Census Bureau. The dividing line between urban and rural is a very small population number. It's only about 5,000, and so places that I probably would have considered rural, in my ignorance, Census Bureau would go, that's technically an urban area. So what we ended up doing is we grouped county populations together, kind of where the most natural break was, the most logical break in size of population. So a given county will fall into a particular group based on its population size. I do have the list available of what counties went into what population sizes, but this was an attempt to show what kinds of unfounded allegations, how many and what percent they made up for a given grouping of a population. And so it might be worth noting that on the left, these population groupings are not necessarily in order, because we're looking at the largest counts from top to bottom. And so county population 200,000 to 425,000 has the most unfounded allegations by count. Of note, worth noting, the one right below it, county population 425K plus. That's just Multnomah and Washington County. Those two counties by themselves, and they're significantly more than 425,000 in that population. But the top one with the 200 to 425K is Clackamas, Deschutes, Jackson, Lane, and Marion. So still kind of still in that valley type, just over the mountain sort of regional area, and just doesn't include, Multnomah and Washington, because they were so much larger on their own. So,
and I think some of you had asked for, what do things look like across the state, and I think this is kind of just an example of across the state in these different districts, regardless of the population size. These happen to be unfounded allegations by type, but they're pretty consistent across the state, right? They're unfounding neglect and threat of harm more than anything across the state, pretty consistently. So in terms of how we're looking at how the system is working across the state, it's pretty consistent all the way down in terms of all of the allegations.
Mm-hmm.
So that was my last slide, and I'm getting.
I want to thank you, Roy, for going
Thank you.
over time with us and all the work you did to get this put together. And we will maybe get back to you on the format. We'd love to share this out with the group. Yeah,
Okay.
if it's different than the slides. Okay.
Thank you. Thank you so much for your
Thank
grace and
you.
patience with me as I work through this.
No problem. It's all a learning curve. Thank you.
Thank you. Take care.
Bye. Right. So I think we also, so sorry, you guys, we were going to take a break like about 25 minutes ago. I think we still can. And when we come back, we don't have any more content to do. I think we can just reflect and pull ourselves together about how we want to proceed with our committee structure, maybe some refinements to that based on your input, and do some decision making around taking some of this information and taking it to the next step. Okay. So why don't we, if Sylvia, you're okay, and Sarah, you guys are okay with us taking a break now? All right. I have about, if we could come back at 3:25, that would be great. And we'll wrap up our last half hour together then. Okay. I'm going to go ahead and stop sharing for just a moment and pause our recording as well.
Leslie, do we did we want Leslie to stay on in case there are
Okay, I think we'll get back together. Thanks, you guys, for accommodating such a quick break. All right, so I think if everybody's back and there's just a few little wrap-up slides I'm going to let Sylvia cover for us, and then we'll turn our attention to our next steps.
All right. So we've looked at data. We've looked at, in particular, we've looked at the impact of the threat of harm and neglect statutes on our Oregon's population, ethnic populations. And we also know that across the nation, research tells us that families in poverty and families of color are overreported to child welfare hotlines and over-investigated and then disproportionately represented in our child welfare systems. Those are all the data is available for all of that. And so what we've seen states doing is really looking at how do we take that out of the mix? How do we account for that? And so you see many states putting in poverty exceptions in their abuse and neglect definitions. And these are just a couple examples that we were able to gather from some states. These are 4 of the states that are used as comparison states to Oregon. Massachusetts it's not considered neglect when the inability to care for the child is due solely to inadequate economic resources or the existence of a handicapping condition on the part of the parent. Washington State goes into talking about how the fact that siblings share a bedroom is not in and of itself negligent treatment. Poverty, homelessness, exposure to domestic violence that is perpetrated against someone other than the child doesn't necessarily constitute negligent treatment or maltreatment. There's got to be a connection. I think what they're saying is it got to be a connection between what we're seeing as the allegation and the impact to the child, right? Connecticut, a child for reasons can be found neglected for reasons other than being impoverished has experienced it. And then they list the following things, but other than being impoverished. And then Iowa includes one as well where they say when financially able to do so and when offered financial or other reasonable means to do so. So these are just a few examples of what we've put together from the states that were in comparison, but many of the other states are adding these to their neglect statutes. I think we talked with Tennessee, who said they're in the process of doing that. And I believe Wyoming said that they're going to be in the process of doing that as well. Next slide. So our task really, we talked about having 2 subcommittees. We talked about the one earlier, the jurisdiction. Now we want to set up another, we want to set up another subcommittee. This one's going to focus on this threat of harm and neglect definition. We want to look at the current threat of harm statutory definition and be able to review how structured decision making has helped the hotline provide some specificity to that threat of harm definition. Using that, review the compiled list of the Oregon statutes that are related to neglect and threat of harm, compare them to the neglect statutes of, actually it's the 9 comparison states, because we included the Iowa, Oklahoma, and Connecticut that were in the original BPC report. So we've got the 6 states we did, and then the 3 states that were done by the BCP report, and then draft a new neglect definition that really incorporates all the appropriate elements of neglect based on the comparison to the other states and what other states have in their definitions, as well as those additional statutes that are in Oregon that could be included in neglect. Add language to address exceptions for poverty to the neglect statute, and confirm an elimination of that threat of harm as an abuse type. That would be the task. So we want to develop a subcommittee focused on this definition. Next slide, Leslie. So basically we're saying formulate a new neglect definition which incorporates those key elements for threat of harm, poverty exception, and eliminates threat of harm. At least 10 members of the group with 2 co-leads. The time frame would be to share a draft proposal at the February 12th meeting. And there are some resources that we would provide to the subcommittee to do that. Remember, we're looking at 2 subcommittees. We would like to meet weekly and be able to have the January 29th, a portion of that meeting would be meeting time for the committee as well. So this is the goal of what we want to be able to do.
For the second, yeah. And Sarah had her hand up.
Yeah, I see it.
Just have a question about the resources. I wonder if there's information that can be provided around what other states do regarding domestic violence, because in your third point of, tasking the subcommittee to look at how to eliminate the threat of harm definitions, they include domestic violence. And so that's question 1. Question 2 is also, can we provide information about how other states address what we call threat of harm physical abuse or threat of harm sexual abuse? Since our threat of harm definition includes more than just the potential of neglect taking place, I would think it would be important to provide the committee with information about how to take those other things into consideration as well.
So I think the neglect statutes that you're going to review, that they're going to review from other states, some of them include those elements already. So, I certainly think we can look for additional states that include that in their definitions. We've provided 9 different states with their definitions, which do include some of that in there. Not all of them do, but some of them do. Some are very short, some are pretty lengthy and include a lot of that in their neglect statute. So I'll take another look at them before we provide those resources, and we'll see what we can provide that would give more information.
And you will have one of us as part of your subcommittees too, so that as needs like that arise, as you guys are digging into this stuff, we can certainly keep that feedback loop going if there is something else required. But thank you for that, Sarah. That's good distinction. Annalise?
Yeah, I just wanted to clarify. I can never remember. Is 419 the
fee? That's
Otis,
the
or is
one that
the
applies
child-
to everybody. That's the one that applies to everybody.
Okay. And then, so Otis might be investigating this. Also, child welfare might be investigating.
Correct.
Okay. And this neglect and threat of harm could be either in the home or in a care situation, temporary or permanent. Right? That definition applies to when children are in like childcare or foster
It
care.
does. Yes.
Okay. All right.
Thank you, Lindsay. Okay.
I think there's an important question in the chat.
Oh, thank you. Sorry, missed that.
No problem.
Okay. Yes, so is that decided? Are we eliminating threat of harm? Yeah, we knew that would get your attention. And, you know, we want you to just think about moving toward that if possible, or at the very least, we'd like to whittle it down to exactly what isn't accounted for in terms of harm, as opposed to just risk of future harm. Do you know what I mean? Because if there's a category of abuse, for sure, actual harm that's happening to people that cannot be accounted for anywhere else, then I think as we place these things in more natural buckets, if you will, it'll become clear what that is, right? But what is odd in this instance, and this sort of bleeds over into the prevention conversation and some of the other conversations we were having earlier, is that it's very unusual to bundle into your monitoring of how much harm is happening in Oregon, how much possibility of harm in the future might be happening in Oregon at the same time. Do you know what I mean? And so that's what we're trying to get toward, is teasing that out, to whittling it down to what's left in threat of harm that matches your reporting requirements or any other surveillance that you want to be doing to understand your abuse population in a way that doesn't create over surveillance, doesn't, create these undue burdens on the investigatory staff, or the trauma into people's lives, or the disproportionality themes that are happening, and really get clear on how we're sharpening how safe children are in Oregon. So that's a good one, right? It may just come down to domestic violence itself, right? And frankly, I think that would be way more meaningful for you to be able to report out every month or year how much domestic violence harm to children is domestic violence related harm to children is happening in Oregon, than it being buried in this enormous pile of other things that are all clustered into threat of harm right now. So I can see that being an outcome of this committee, right, Sylvia? Can't you? Potentially.
I think the committee needs to look at how, just the breadth of how it's done, how these things are handled. And I don't think we're saying anything other than to take a look at it and see how it can be more comprehensive, how your neglect definition can be more comprehensive and not leave this broad category of everything in the kitchen sink in it, I guess.
Does that help, Sarah? Because we'd love for you to come back and say, no, we can't completely eliminate it. We have this left over, and here's why. That would be a great conversation for us to have. Adam, go ahead.
I mean, I think on the surface, that's a little scary to me, to eliminate threat of harm. And I agree with you that, like, domestic violence, right, is harm. And so if we need a category to catch that, but like, do we feel confident that we really know what else is being thrown into threat of harm? Because I'm like reflecting back to my days, 15 years ago now as a caseworker at DHS Child Welfare, and like, there's a lot of dangerous situations that kids were in that we use threat of harm to keep them safe. And so do we know, and is it possible to, and it's like threat of imminent harm. I mean, I don't feel like it was unnecessary. So is there a way we can peel into what is founded in threat of harm? I don't know that there is in the data. And I guess I'd look to Sarah or Lindsay maybe for that answer. There isn't. You already know that. There's no way. Is that what I'm saying?
Sarah?
Well, I would let Leslie speak to the founded dispositions. What I was going to say is I do think practice both in screening and CPS has changed drastically in 15 years. And at least at screening, I can speak to screening. I'll let Leslie speak to CPS. You know, as you saw in the structured decision-making tool, there are only very certain circumstances in which we can allege threat of harm. The purpose of doing that in the SDM tool was to stop any kind of, or at least mitigate against bias where, let's just call it threat of harm because we're worried or we're concerned. We really tried to make it more, this is what you have to have in your report to allege threat of harm. But again, and I know anecdotally, there's been a lot of work on the safety program side, the CPS side, to address threat of harm disposition practice as well. But Leslie could probably speak better to that than I can.
Thanks, Sarah. So just to clarify, when a call comes into screening and it gets assigned for threat of harm, screening assigns for threat of harm using descriptors of threat of harm. It has to meet one of those categories. But when a CPS worker is going out and doing the assessment into threat of harm, they're not just looking at which descriptor was picked, right? They're looking at whether there was threat of harm in general, like all those subcategories. Just like at screening, when it gets assigned for neglect, they specify which neglect it's getting assigned under, like which type of neglect. But when a CPS worker is doing their disposition, you'll frequently hear us say neglect is neglect is neglect. And one of those different ways that a child can be neglected is what's used to describe the type of neglect that occurred. And what I can say about threat of harm is that our practice for founding an assessment for threat of harm is that the child's physical well-being, sexual, I'm losing the words right now because I'm on the spot, but the child is at risk of being significantly harmed through sexually, physically, mentally, or is at significant risk of not having their needs met, right? Those are the reasons that it would be founded for threat of harm or domestic violence, right? The child is at risk of being significantly harmed because of domestic violence type situations. And domestic violence situations impact the child mentally or physically usually, right? Those are the ways that it gets impacted. So CPS will say threat of harm is threat of harm is threat of harm, but the reality is we have to be specific as to the type of harm the child is likely to experience, and that's sexual harm or mental harm, psychological harm or physical harm.
But is that pullable, like clearly and easily from ORCID's data or somewhere else?
Well,
that's not
from the screening report. From the screening report that is assigned, yes. But
that would be a manual.
At disposition, we look at the umbrella of whether it was founded for threat of harm. So screening might pick 3 different ways there's threat of harm. And I know that's not always the way it happens, Sarah, but sometimes does the 3 different types of threat of harm. But CPS is just going to look at generally, is it threat of harm and what type of disposition is it? They're not going to separate out at the end each individual descriptor type.
So you can't report on any of that detail?
No, it wouldn't. No, because it's just one of the main abuse types, right? Like we have neglect, we have threat of harm,
But it's
we have sexual
yeah,
abuse.
and I think the thing that we're suggesting here is let's test how much is it really an abuse type, or is it simply an inkling of concern that in the future sometime there may be some safety issue that comes to fruition.
Well, the process of having a founded for threat of harm means that the worker has to have reasonable cause to believe.
Right.
So
that there's
there has to be
significant
something
risk,
that the
not
child,
imminent risk. Yeah.
no, that it has to be significant harm, right? There has to be something that connects it, a likelihood that that child is going to be severely harmed, right?
That there's a risk of them being severely harmed, not that
there
they
is the
are
risk.
severely harmed.
That there is a risk, but
Yeah.
we have to be able to describe both those things. So we can't just say, you know, a speculative threat of harm. There
I
has
see.
to be a reason
Yeah.
that
got
we have to say, like, this child is at risk because of A, B, and C, and the harm that they're likely to experience is severe because of A, B, and C. Like, we have to put those things in there. And
Yeah,
if
but
it-
the
and if it
shame
doesn't,
about
gets
it is
overturned.
that you can't analyze that flow at all. You can't know how many of those are we naming, are we intervening on, and are we not seeing come back through the door later for that specific reason that we were trying to interrupt. That's the shame about it. Yeah. So Amelia, go ahead.
The sun went down, so my office is very dark. I'm sorry.
Oh gosh. Okay.
I just wanted to say, and I think I might have mentioned it before, but we are in a county that's like, we have a lot of families that go back and forth between Washington and Oregon, and Washington does not have a threat of harm statute. And there are a lot of gaps in things that you know, we see that like Oregon would investigate, but Washington doesn't, that I think are really critical. I do not have time to commit to being on a subcommittee right now, but I feel like there is threat of harm under each of our abuse types. So like threat of harm under neglect, there's threat of harm under physical abuse. And like in Washington, if you are perpetrating sexual abuse against one child, then there's no investigation on the other children in your home. And there's no like statute that would say that those other children are at risk. And so we're up against that a lot with our families where you know, there's like kind of that cross-border jurisdiction, and you know, where Washington state just won't investigate. And you know, particularly with sex abuse, we know that yes, there can be targeted children, but that's a massive risk for all of those other children in the home. And I just you know, I feel like I'm okay with us considering incorporating threat of harm into like the other abuse categories, but I feel like if you're just wanting to combine it with neglect, that would be I would take issue with that.
Well, can we get a committee going that's willing to just dip their toes in the water and start to explore this with the resources that we'll bring forward to do that? Because I think we could get partway down the road for sure. Don't y'all? And then we'll bump up against all of our boundaries around this and be able to justify that.
Yeah, who would be willing to be a part of that definition subcommittee or the jurisdiction subcommittee, one or the other? We need some members to volunteer to do that.
Did I miss anything? Excuse me, this is Nicole. Did I miss anything about the time commitment for those subcommittees? Just what we can expect for what that time would look like?
Yes. So I think Sylvia mentioned it orally. So we're looking to, we're going to use our next meeting on the 29th for time for you all to meet, but we'd like to meet, try to have communication once a week between now and the meeting on February 12th to explore this.
Okay, thank you.
For like an hour a week we're looking at.
Okay, we got Scott for Juris, Iris for Juris, Annalise for either.
Okay.
I'm trying to keep up.
Yeah. Oh, thank you. Okay, good.
Tori for Juris. Okay, you write him down.
I got him. Yeah. Lindsay for either. And Lindsay Moore, can we extend that to Kristen, that maybe you guys could share a role?
Yeah, I think we're going to talk with leadership to determine how best to divide that. But if you could just put DOJ for now, and we will get back to you shortly with who would be the representative.
Thank you so much.
Chris for definition.
Chris, okay.
Lindsay says both.
Which Lindsay?
Lindsay Moore. DOJ,
yeah, I got her.
Okay.
Yeah.
Nicole, be on both. Nicole.
Okay.
Brian, Juris.
I'll do either, Sylvia. I just don't. My experience isn't as much in the. I'm worried about impact. I'm just thinking about what Brendan said weeks ago about changing 419 at all. So I hope that he or someone else will be on that one. Someone with similar background.
Samantha for definition. Anna for definition.
Okay.
Adam for jurisdiction. Sarah wants to scroll back so she can see Sarah Stewart, the jurisdiction slide.
Oh, yes, of course. Let me do that. The task, you mean? Yeah. Sorry, I didn't bring that down. And there we go. And I think we kind of discussed this to just massage this task a tiny bit to really be thinking about that. Right? That line between risk and safety again, right?
I think I got everybody.
So
Did you get
Sarah, you want to be on Sarah Stewart? We'll put you on definition then, right? Okay, perfect. Yes, Anna, thank you. Yes, thank you, everybody. I know people have to jump off we're just coming up on the hour here. Alexis will do definition as well. And yeah, okay.
Did you get Lindsay Bigelow for Lindsay? I think it was for definition.
I can do both. Jurisdiction would be more my expertise, I think. But if you need to go on definition, I can do that one as well.
Okay, thank you. Okay. Anybody else? I think we've got 1, 2, 3, 4, 5, 6, 7, 8. And there's about 9 on jurisdiction right now. These folks, for the folks that said either, that does not mean both, correct? That means one or the other. For Nicole.
This is Annalise. I'm open to whatever.
Really?
I'm willing to do whatever. And if I mean, I kind of serve a unique role in that I don't work for the state. I don't work for an entity that runs investigations or participates in investigations, and I'm not a contractor with the state.
Yeah.
Here, so we're like the school district, but we're a separate entity regulated by DELC instead of the Department of Ed. So
Yes.
I'm willing to sit in and do both if it feels it's helpful. Otherwise, when we get to the end, and if I don't like something, I'll raise my opinion.
We'd rather have you in from the beginning, Annalise.
Well, yeah.
That'd be
So
great.
that's my point. So whatever is needed, I'm willing to do.
Perfect. Thank you. So that means we've got like 9 in juris so far and 8 in definitions.
And this is Nicole. I'm happy to be on either. I think that for the scope of our work, the jurisdiction subcommittee is a little bit higher on my priority list than the other, but I absolutely have a stake in both and would be very happy to be on both or either.
Okay, perfect. Thank you. And I think I counted you already, Nicole, so that's great. Okay, perfect. All right. And we got Sarah Stewart. Okay, I think anybody else? And I'm gonna get you. Paris.
What would you like us to do if we're very concerned about a time commitment of a weekly meeting, but we're happy
Yeah.
to be available as we can? I cannot commit to another week.
Of course.
But
Hey, can you just be on our email chain or something, Brendan? On one or both of these, like sending you the materials and.
sure, I think I'd probably be more helpful on the jurisdictional.
Yeah. Okay, great. I'm going to add you over there. And we won't worry about your schedule so much, but what we're thinking we'll do is probably like upload things to our hub or email them to everybody so that everybody's got the materials. And if you have to miss the meeting, we can, you know, we're going to have to record it or something, and you can weigh in that way. We can send you the transcript or something. Whatever works best, Brendan. I just don't want you to get too behind. You know what I mean? Like, and if there's cautionary notes that you want to send in advance, please do that.
Okay.
You know what I mean?
Yes, I do.
That would be helpful too. All right. Good. Well, and know that I'm going to help be the the sort of guide person for the jurisdiction one, and Sylvia will be for the definitional one. And so we're not going to just send you off and say, okay, go forth and do this work while we go do other things. We are going to do other things as well. We're going to also be digging into the MDT stuff, the prevention stuff, the alternative pathway stuff, while we're helping manage and guide you guys in some of these decisions that you're going to suggest in the subcommittees. But we need your muscle to help us get through all of this. Okay. Anything else, Sylvia, that you wanted to add in terms of? Let me fast forward to our end here. We are actually, you know, we'll plan for the 29th meeting with, we're going to have some discussions about this big scope that we have to tackle here and get you a clearer picture of how we're going to move through all of this over the coming months. We'll have time to meet in the subcommittees on the 29th, and we want to start doing some presentation on some of these other topics that are related as well. We said due process here, but we'll see which one kind of rises to the top given our meetings with other key informants and that sort of thing. And other than that, we just
Well, Brian, we will have to send out an email to the members of each of the people who volunteered for each committee to try to schedule.
Yeah, because we're going to try to schedule something between now and the 29th, obviously, because that's like 3 weeks from now. And so if we can get a couple of meetings, so we're going to take this list and we'll send a communication to you guys with the resources within the next couple of days so that we can get a doodle poll or something to all of you and we can find the dates for that initial meeting. Okay. All right. I think that's our plan. Thanks everybody for all your time and energy and wisdom. Appreciate it. Have a great week, everybody.
No, Brian, the 29th would not be the first subcommittee meeting. We're hopefully to meet before then.
Correct. I'm going to go ahead and stop sharing.